Hello everyone, so this is Shruti Ahuja and in this video we are going to talk about the muscles of the thigh in the anterior compartment. So I will talk about these 5 muscles in detail, the origin, insertion, and basically I will give you an overview how to visualize those muscles, how are they located, and then we can move upon to the other parts of the theory in anatomy of lower limb. So first of all, you can see very well that this is the ASIS and this is the pubic tubercle. Between these two, which ligament is there? Inguinal ligament. True. This is this muscle which I have marked I have drawn the boundaries for you. This is the iliacus muscle and this is the psoas major muscle. And below the inguinal ligament, we can see these two becoming one muscle, which is the iliopsoas muscle. This is just for our reference. I am telling you again, these things usually you don't have to write in the exams. You just need for your remembrance of the topic and for your memory purpose and some landmarks which can help you to identify it in the cadavers at the time of vivas and in the D halls. So next is this is the pubic tubercle. With this landmark, we can see here is like the crest above, like beside the pubic tubercle, there is a line. I can show you in this also. Here you can see pectineus muscle origin. Okay, so from here it is originating, pectineus muscle. And in the posterior view, here on the pectineal line, it is inserting. Just remember, it is going posteriorly. So always it will be below the iliopsoas muscle because it has to go posteriorly. If this is iliopsoas, I have to go like posteriorly. Okay. Next is, this is the pectineus muscle which we have done. Next comes here. This large muscle I can see. Okay, this is the tensor fascia latae muscle, which is just like the superior one, but it is going posteriorly. Just remember that. Next, here this prominent muscle I can see, which I have marked in purple color. This is the vastus lateralis because it is on the lateral side. Very clear. This is the vastus medialis, which is just below the sartorius. This long muscle which is going from lateral to medial, it is the sartorius. And this is the vastus medialis muscle. And in between these two, I am having the rectus femoris. But if I will remove the rectus femoris, I can see the vastus intermedius muscle. Okay, if I just remove the rectus femoris. Now, sartorius also I have told you. This is the sartorius and it is going here, down here. This insertion, you can see vastus muscle tendon. It is going down here to the tibia. Next is, in this picture, you can see these things. Like here I have just removed, this is the rectus femoris origin. Okay, from the anterior inferior iliac spine. As you can see that this is the ASIS, this is the AIIS and rectus femoris origin from here. And I have cut these things basically. Now rectus femoris or a tendon is here and this is the quadriceps femoris tendon. Now here, if I have cut also the cut tendon of the sartorius tendon, right? This is the sartorius tendon inserting here. So you can this way very well see all the muscles of the anterior compartment. And if I also cut the iliopsoas muscle, because I told you, because the pectineus is going just below the iliopsoas. So this is the pectineus. From the pectineal line to the pectineal line on the femur it is going, and from the crest on the pubis it is originating. You can see here the pectineus muscle. Okay, I hope these muscles are very clear to you. Now if we move on to the deep dissection or deeper views, then I can see the pectineus muscle cut and reflected here, and here I can see the iliopsoas muscle cut, and here is the pectineus muscle cut and reflected. Okay, and this is the vastus intermedius muscle. This is the cut. Now you can guess, if this is intermedius, what will be this one? It will be lateralis. Okay, and this one, it will be the medialis one. Next is this is the sartorius tendon cut, and this muscle is the quadriceps femoris. This is iliopsoas pectineus, and underneath it you can see the quadriceps femoris. So this was about basically the muscles. Now if I tell you that you just need to tell me which muscle is crossing what. So here in anterior compartment of thigh we can see the muscles which are the iliacus, we have seen psoas major, we have seen pectineus, sartorius which is the longest muscle, quadriceps femoris which have the rectus femoris, vastus medialis, intermedius and lateralis in a group. So that is why it is called quadriceps. Quadri means 4. Next is, I want this part is very important because this will help you know and learn the movements in the hip joint, which we will learn afterwards. Here you can see that the psoas major muscle and the iliacus muscle, this crosses only the hip joint. We have understood it is originating from basically the above bones, which is the hip bone, right? Majorly. So it is originating from that and it is inserting on to the femur. Some it is inserting onto the femur. Here you can see very well that it is the iliopsoas muscle or insertion. This blue color one, it is the insertion on the lesser trochanter. So it crosses only the hip joint. So it will be a hip flexor only, no role in the knee. Next is the rectus femoris, which crosses the hip because it is originating from anterior inferior iliac spine, and it has some role in the knee joint as well. Why? Because its insertion is on the, as we can see here, this is the insertion of the rectus femoris. Like this is the rectus femoris. Because it has attachment to the knee, like the joint parts, so it will be a knee extensor. So hip flexor will be a knee extensor. You can correlate that because both the movements are opposite. Next is vastus medialis and lateralis. Medialis and lateralis, these have role only in the knee joint, not in the hip joint. Why? Everything has a reason out of it. Here you can see the lateralis muscle originating from here, medialis from here, intermedius from here. So these are originating from femur, but they are not crossing these joints. So we can say they have role in only the knee joint. Next, sartorius. Sartorius we know from the ASIS and going to the tibia right here. Sartorius muscle insertion you can see. So they are crossing both the hip joint and the knee joint. So we have to write they are crossing both the joints, but it is not a knee extensor. We need to learn that because its movement and its location is such that it does not help in knee extension. It helps in some other movement there, but we will learn it afterwards. Next is pectineus muscle. So pectineus muscle also we know from the crest on the pubis and to the pectineal line. So we can say that pectineus is only crossing the hip joint. So not a knee extensor, but only a hip flexor. So this thing you need to know, and this will help you strengthen the concepts of the muscles and how they are present, what they are doing. So if you like this video, then do watch the next one also, and do save this in your library and share it with your friends because sharing is caring.